Hi everyone, thanks so much for joining me today for Tips and Tea with Linnea FNP. I'm Linnea Baker and I am a board certified family nurse practitioner for those of you who don't know me. I have my tea today in my, let's see, today we have the Hawaii mug we're using. And today we're going to talk about what does dental health have to do with heart disease. This is something a lot of people are not aware of. So in part of our awareness to be proactive and advocate for our health, we're going to cover this today. This is coming from the book, the series we've been working on, Healthy Heart, Healthy Brain by Doctors Bradley Bale and Amy Doneen. Thank you so much for joining me, and I hope this brings you value. Okay, so first, what is periodontal disease? Periodontal disease is a disease of the gums, and the gums are the gingiva, and that's in your mouth. And gum disease starts with what's called gingivitis, and anything that ends in itis we know means inflammation, so it's inflammation of the gums. If gingivitis is untreated, periodontal disease can follow. Periodontal disease is one of the most common chronic diseases. I don't think most of us are aware of that. I know I wasn't. However, periodontal disease is preventable because gingivitis can be reversed. However, if you don't catch it early when it's gingivitis and it progresses to periodontal disease, well, periodontal disease is not curable. You have to catch this in the early stages of gingivitis, and hopefully even before you end up with gingivitis, you're doing good care, and that's what we're going to talk about today. So periodontal disease is not curable. However, if you're getting the correct treatment for periodontal disease, it can actually stabilize this disease so it prevents further damage. And usually that takes 3 to 6 months of receiving active treatment followed by maintenance care to keep the disease from being reactivated, okay? And periodontal disease affects 50% of Americans 30 years old and older, guys. I had no idea how high a number that was, and it affects 70% of Americans 65 years and older. The early stages of the disease are usually painless, so many people don't realize they have the disease. And this is really important. Any form of nicotine use is the leading risk factor for gum disease. So when we talk about healthy lifestyle, being able to go to your healthcare provider and receive help to stop any kind of nicotine habit you may have is a big one towards overall health and wellness, okay? So what's the oral microbiome? You guys know I talk a lot about gut health and the gut microbiome, but did you guys know there's an oral microbiome? And the oral microbiome, as you I'm sure guessed, is in your mouth. It contains over 700 species of bacteria. Think about that. Many of the bacteria are harmless or even beneficial because we're in this symbiotic relationship typically when we have a healthy microbiome, whether it's our gut microbiome or our mouth. We have this symbiotic relationship where they live on us and they help us, and we provide the host for them. Also, not only over 700 species of bacteria that are harmless or are usually harmless or often beneficial, not always. We also have microbes such as fungi, viruses, and protozoa. So very similar to what our gut microbiome would be, right? The oral microbiome, if it's healthy, helps play a key role in food digestion and disease prevention. Did you guys realize that disease prevention starts in your mouth? Very important. I think that's a big thing to recognize, and I don't think most of us ever think that way. I know I hadn't for a long time. So the oral microbiome actually helps regulate your immune system. It maintains a balance between the pro-inflammatory and the anti-inflammatory processes, right? We talk about chronic inflammation all the time and how that's the playground for chronic disease. It detoxifies environmental chemicals when you have a healthy oral microbiome, and it repels invading pathogens. An unhealthy oral microbiome. So what would cause that, guys? Well, poor oral hygiene, right? Not doing appropriate dental care, and going to the dentist routinely and all the things. Stress, obesity, insulin resistance, having an unhealthy diet. All of that can lead to the overgrowth of the bacteria that cause periodontal disease. Now, I will tell you, before I started, now it's been over 3 years, but before I had started my healthy lifestyle and really leaning into taking better care of myself, the stress, the weight, the unhealthy diet, all the things. Now, I was taking good care of my teeth as far as going to the dentist and things, but all the other things, the stress, the being overweight, and being unhealthy in what I was eating, I did start having gingivitis and bleeding and irritation in my gums. So I was at the beginnings of that, and I've completely reversed that just in healthier lifestyle and taking better care of myself, because it never progressed to the periodontal disease part. So, what are some signs of gum disease? Any sign of bleeding gums is a sign of gum disease, including if you have a pink tinged toothbrush after brushing your teeth, or spitting out blood or pink saliva. Now, granted, obviously you could have a cut in your mouth or other things, but these are typical signs that can mean gum disease. Red, swollen, or tender gums, where they get real irritated around the teeth. Gums that are receding, so they make your teeth look longer than normal. Sensitive or loose teeth can be a sign. Changes in your bite, having trouble where it's painful or uncomfortable to chew, and persistent bad breath. Now, obviously, these are symptoms of other types of things going on as well, but these are your warning signs that something's not right and you need to get that checked, okay? So, dental health and chronic disease, how does that link? So, research has actually shown that people with gum disease and the bacteria that can cause it and poor oral health are actually linked to having many chronic and oftentimes life-threatening diseases. This is all linked together. So, some of these diseases that are linked together are heart attacks and strokes, diabetes, some cancers, erectile dysfunction, obesity, rheumatoid arthritis, and Alzheimer's disease and dementia. So when we talk about gum disease, heart attacks, and strokes, what's the link? Well, people who have periodontitis are 2.5 times more likely to suffer a heart attack than those with healthy gums. Your mouth and your teeth and your gums are the window or the doorway to your overall health and what's going on the inside. So it's very important. If this is not in good shape, we know that there's probably a lot of stuff going on inside that we don't see. Persons who have infected gums are 50% more likely to suffer from a stroke or angina. Angina is chest pain from trouble with the blood flow in your heart from coronary artery disease. Oral germs, such as those that cause gum disease, can enter the bloodstream and quickly spread throughout the body. Well, how does the germs get into the bloodstream? It can get into the bloodstream through chewing your food, brushing your teeth, flossing, getting a periodontal cleaning, and tooth extractions. And they also can spread, the spread of the bacteria from the oral cavity can lead to chronic inflammation, and that ignites arterial disease. So this is people with infected gums. We're talking about oral germs, the bad bacteria, the stuff that we don't want, because we're not, we have infections and things going on in our mouth, and that's what's getting into the blood and creating the chronic inflammation. We're not talking about when our oral microbiome is healthy with the good stuff in it. Now, gum disease isn't just, this is a direct quote, gum disease isn't just a risk factor for developing arterial plaque. It is a potentially preventable cause of the disease. That's powerful, guys. Just taking care of our our dental health, our oral care can absolutely prevent the cause of arterial plaque. So when we talk about gum disease, heart attacks, and strokes, what are some additional factors that affect gum disease? Well, the LDL, which we call the bad cholesterol, people who have gum disease have 2 times as many small, dense LDL cholesterol. Instead of those large, fluffy LDL particles, they are actually transformed into smaller, more dense particles, and that doubles the ApoB level. And the ApoB is present in all bad cholesterol that circulates in your blood, and the ApoB is the most predictive lipid, which is a cholesterol measurement of heart attack risk. So we're doubling the level of ApoB by creating these more small, dense particles of cholesterol, and that's associated with, that transformation's associated with gum disease, guys. So we're increasing the risk of heart attack through that. Now, other factors that affect gum disease when we talk about heart attacks and strokes or affected by gum disease, bad oral bacteria. So the bad oral bacteria, the ones, and they named a few in the book that are not They're the high risk bacteria, the ones that can create other issues with heart disease and other chronic diseases. These are high risk oral bacteria, and they actually have chemicals that come from these high risk bacteria. These high risk bacteria produce chemicals that get into the artery wall and make it more permeable. So it means it allows more things to get in. So it's allowing for the bad cholesterol to enter the artery wall easier. And then substances that are also produced from this high-risk bacteria can make the inner layer of the artery wall more sticky, like a Velcro. So not only is the bad cholesterol able to get in easier, and remember it's smaller and more dense, it's able to get through the artery wall lining easier. Well, now it's got a Velcro-like substance on the artery wall, so it's going to stick there easier. And so that's where the plaque goes to form. And that bad cholesterol gets trapped in there and can create plaque deposits. So do you see how this cascade of problems happens to create this much more significant risk of heart attacks and strokes just from having poor oral care and gingivitis leading to periodontal disease? All right. So diabetes and gum disease. So people with diabetes, and I believe they're talking about type 2 diabetes in the book. They didn't specify that they are 3 times more likely to have infected gums than non-diabetics. Having gum diseases increases the risk of developing diabetes to begin with. So having gum disease increases your risk alone. Just having gum disease increases your risk of becoming diabetic. And that's because gum disease contributes to insulin resistance and increased blood sugar levels. How crazy is that? That just gum disease alone can contribute to insulin resistance and increased blood sugar levels, which we know leads to diabetes. So people with diabetes and severe periodontal disease are 3 times higher risk for cardiovascular or kidney complications. We know that kidney disease goes hand in hand with diabetics. Incredible information, guys. So I hope this is just making you more aware, because remember, it's not to scare you, it's to provide education so you can advocate for your health, because if we know better, we can do better. Okay, cancer and gum disease. Colorectal cancer. Persons with severe gum disease have an 80% higher risk of developing colorectal cancer. Crazy. Lung cancer. Those with severe gum disease have double the risk for lung cancer than people with mild periodontal disease or healthy gums. And in breast cancer, there was a study that showed women with periodontal disease faced a 14% higher risk of developing breast cancer. Absolutely insane, guys. So this is something that we can absolutely do to be better at, now that we know better, take better care of our teeth and our oral health, and make sure we're getting our regular dental visits, and we are helping prevent chronic disease just by taking care of our oral health. All right, when we talk about erectile dysfunction in gum disease, men with ED are 3 times more likely to have periodontal disease. And this was crazy. They said studies demonstrated that when treating the periodontal disease, they saw a rapid improvement in erectile dysfunction in men. So just something to be aware of. Obesity and gum disease. Obesity is the second biggest risk factor for gum disease, and those with obesity are at 2 to 3 times the risk of developing gum disease. And in the research, they linked an oral bacteria called Pseudomonas noxi, I spelt that wrong, to those that were overweight. So we're now trying to look at this specific bacteria in the mouth to see if that bacteria is actually linked to causing obesity, because we're finding out so much more about the gut microbiome. Well, now that we're learning about the oral microbiome, they're wondering if there's a link between the type of bacteria and then people struggling with obesity. There is no judgment here. I am here just to give information, and I know we're all struggling with different concerns and things going on, and it can be very frustrating and overwhelming. But I did want to point out that, there's a lot of research going on now with other reasons why we may be struggling with obesity, and I have done some other topics like on metabolism and things. So reach out to me if you have concerns or are frustrated and you'd like more information. Rheumatoid arthritis and gum disease. Studies have reported high rates of periodontal disease in people with rheumatoid arthritis, right, which is an autoimmune disease. And they said that when they treated the gum disease, that resulted in reduced pain for the people suffering from rheumatoid arthritis. They had a reduced number of swollen joints, and they had reduced morning stiffness when dealing with rheumatoid arthritis. Just from treating the gum disease, guys. Crazy. So research is now being done to see if when they optimize the oral care of people that have a high genetic risk of developing RA, could they avoid getting the RA disease altogether? So really cool stuff is out there in the research being done as we speak. All right. Alzheimer's disease, dementia, gum disease, such a tough and difficult disease. If you've ever had a loved one face this, I've had friends and family members deal with this, and it's so, so tough. Recent studies are linking gum disease to cognitive impairment and memory loss. So I'm getting closer to 50. My husband just turned 50. We're going to be definitely paying attention to these things. One study found that people with periodontal disease are up to 70% more likely to develop Alzheimer's disease. So how do you optimize your oral systemic health? Well, there's a CBCT, which is a 3D cone beam tomography image for radiology test or an x-ray. And if you've had a lot of dental fillings or you've had a lot of dental work like root canals, your dentist might recommend this imaging to determine if you have endodontic disease. And CBCT testing, when they do this imaging, is 96% accurate in finding periapical abscesses and other signs of endodontic disease. So something to talk to your dental health care, your dental provider about. And then for periodontal exams, if you've been for your routine dental exam, they will take a little metal instrument and they kind of just gently poke around. It doesn't hurt, and they give measurements. They'll say like 1, 2, 1, 3, and they go on the inside and outside, so the front and back of your teeth. And they're checking the pockets, which are the spaces around each tooth where the gums connect to where the tooth connects to the gums. And a healthy measurement is anywhere from 1 to 3 millimeters in depth. And 4 millimeters or more suggests gum disease. So I thought that was interesting because they do that when I go in for my checkups, and I wasn't sure what the numbers meant. In optimizing your oral systemic health, the Bale-Donin method recommends that there be diagnostic testing. They want you to get diagnostic testing that measures the oral pathogens through DNA analysis for all dental patients. And even people who's, because even people without, I'm sorry, it says with, but I typed that wrong, sorry. Even people who don't have gum disease, can harbor dangerous bacteria, and it can be silent. So they do recommend that. Now, I talked with my dentist and they don't run that test there. They're not offering that. So that's something I'll have to dig into and find who would do that, but just a recommendation from the book. Another thing, dogs are a potential source of bacterial infection. Now, I love my fur babies. My fur babies I'm one of those people that allows the dogs in the bed, even though my husband doesn't like it. But the book did recommend that you don't let your pets lick your face, and always wash your hands after handling objects that your dogs may have licked or chewed on, such as the dog toys and dog bowls, because they can be a source of bacteria that you can get in your mouth. Get a dental cleaning at least twice per year, or as advised by your dental care provider. I know some people have to go more often. In one study, older adults who had not had a dental visit the previous year had a 50% higher death rate than those who went multiple times per year. So crazy how important it is to keep up with our teeth. I know for a lot of us, it's kind of not as much a priority as other things when we're grinding it out and dealing with all the things life throws at us, but it is truly important for your overall health. So I hope you're seeing that as we go through this today. So what can you do for action steps? Well, if you haven't had a dentist appointment in the last 6 months, make sure you make an appointment and get in and get checked so you can start getting your regular checkups. And usually it's twice a year, once every 6 months, unless your dentist provider tells you for your specific case you need to come more often. You want to brush your teeth twice daily and floss correctly. There's a correct way to floss, so you can check that online, how to floss correctly. Reach out to me to schedule a free health and wellness consult if you'd like more information on overall health and wellness and getting some guidance on what and where to start. It can be frustrating and overwhelming. I know it seems like a lot of people have tried everything and nothing works. I can tell you that what I do is sustainable, it's holistic, and it's for a healthy long term lifestyle. And we always focus on progress over perfection. And then you can refer your friends and family members to me who need support or guidance on healthier and holistic lifestyle. I'm happy to meet with other people through your referrals and recommendations that you feel on your heart would benefit from this. So please refer them to me, send them my way. And also invite friends and family members to this private Facebook group so they can hear this information as well. Because the information we're putting out in this series truly can save a life, and it's important for people to be educated and aware so they can better advocate for themselves. And then just remember, I'm on a mission to positively impact your health and wellness through education and coaching to create generational health and a health span that equals your lifespan. So I truly love what I do. I'm a family nurse practitioner. I did pediatrics for quite a while, so I love that what I do really more is caught than taught, and it drips down to your the kids in your life, and also ripples out to help all areas of your life be holistic and healthier, so you can live that longer, healthier quality of life. Reach out to me for a free health and wellness consult by commenting below or private messaging me. And this is the book that I'm getting my information from, The Healthy Heart, Healthy Brain by Dr. Balin Doneen. This I got from Amazon. I remember I have nothing to do with this book. I think it's very powerful. It's written for people who are not medical. There's lots of great cartoon type pictures to give you visuals. I'm a visual person, especially if you're not medical. It will help you. But this is written to benefit everybody. This is not a medical book. And it's so powerful. And there's so much information in here that I'm not able to cover all of it. I'm hitting some basic highlights, but it's a rich resource. I highly recommend you get the book. You can even bring it in and share it with your healthcare provider when you're asking them for certain things regarding you. And when they say, well, why are you asking this? Or where's this coming from? Or they haven't heard of it, maybe. You can share with them the book and the resource so that you can better advocate for yourself. Okay. Guys, thank you so much for your time. I hope this brought you value. I truly am passionate about helping others and serving others on a personalized health journey that improves your quality of life and supports you and your family reaching your personal health goals. So until next time, guys, please be safe and thank you for coming. Good night.